Hi, I'm Dr. Ron Miller, and this is Dr. Thomas Eberly. We're two of the specialists here at Pursuit. And today we're going to talk about herniated disc and sciatica. So, what should the public know about a herniated disc? And does it always cause sciatica? Does it sometimes cause sciatica? Does it not cause sciatica? So, what are some things to talk about regarding a herniated disc?
So, the first thing is there's a lot of different reasons why you might have back pain, and a herniated disc is one of them. Typically, a herniated disc, when you're bending over to pick something up, maybe twisting, you come back up, you might have pain in that moment, but that gets progressively worse. And many times it hurts more in the morning and you feel stiffness. Sometimes it refers pain down the back of the leg, and that general pain down the back of the leg is known as sciatica. So sometimes your sciatica can be caused by herniated disc, and sometimes your sciatica is caused by something else. It's our job to really do a deep dive in through the examination to figure out what's causing your back pain, because if you have a herniated disc for something else, like an SI joint problem or some other type of issue, we have different treatments for that. And that's really what differentiates us from other physical therapy practices, because our treatments aren't general. They're very specific to what's wrong with you, what's going on with your particular body. So
I have a question. So if someone has a herniated disc, will they always have sciatica?
The answer is no. So herniated discs many times heal on their own within 3 months, but sometimes they become persistent. Our job as physical therapists to get you feeling better quicker and to make sure you know the exercises that will help you long-term so those symptoms don't come back. So that's the primary role of a physical therapist, to get you independent to treat yourself so you don't have to come back once a week or once every 6 months. We really do focus on getting you independent and help you learn how to take care of this. Now, in the initial stages, when you're having a lot of pain, we have so many treatments we can do to help different things that are going on with you. If you have a trigger point, which is a knot in a muscle that's associated with the herniated disc, we have drynenyline for that. We do things like soft tissue massage, joint manipulation. Of course, exercise is always going to be the great thing to do in the right way at the right time. So we'll progress those exercises as you're improving. That will help your pain and help you get back to what you want to do faster. And again, that's our role. Then there's a subgroup of patients with herniated disc, or other things that cause back pain that don't get better after 3 months. And those get a little more complicated. And we definitely are expert at figuring out the root causes of those. Those are a little more persistent, so you might be on a treatment plan a little bit longer. But honestly, if you've had back pain for more than 3 months and it's not going away, you really need to see us, because your body should have healed by now. And because it hasn't, you're going to need someone with our expertise to get you back to doing what you like to do.
Yeah. Is there a certain key that you focus on? Like, what's the key with treatment to know that they're going to respond good to us and not need surgery?
Great. That's a great question. So first of all, it's rarely happened in my career, but over 25 years, I have been sitting with a patient who's had weakness in their leg. And when you have weakness in your leg, that's a red flag. And I've literally made them an appointment for a neurosurgeon that day or the following day. Weakness in the leg is a red flag. Secondly, most of the time, if things are going to get better because you feel better by the end of the first visit. When we spend our first hour to hour and a half evaluating you, we're also treating you. So you are going to feel immediate pain relief. It's not going to completely go away, of course, but the things we do are focused on getting you feel better day one. Secondly, you actually have homework to do. You can't expect to have this.
They want homework?
They don't want homework. Yeah. Unfortunately, there's always homework, right? You can't get away from it. But if you want to get better quicker, you can't think that you're going to come 3 hours a week and you're going to feel better faster. So we give you things to do at home, because even if you come in 1-2 hours a given day, you're still on your own 22 hours. So what do you do the other 22 hours or the other 23 hours? So we give you strategies to help your pain so you can manage your day, because it can be debilitating. And within 2 weeks, you're usually about 90% better if you're in that acute stage.
I agree with that. In 2 weeks, you'll know whether treatment's working or not. So, and yes, it is an active role. It's you and us working together. It's not just a quick fix or a magic pill is going to make a herniated disc or sciatica go away. You'll have an active role with a home exercise program to complement treatment to make sure you get better faster in fewer sessions. So great stuff. We went over herniated disc. Does it cause pain? Does it cause sciatica? Sometimes not. Sometimes, yes. You went over a bunch of treatment options and stuff like that with needling, McKenzie approach, which I think works phenomenal for a herniated disc.
Yeah.
And then needling and some of the other things. And the key thing or red flags to pay attention to when you may or may not need surgery. I think the number one thing to pay attention to is, can you centralize your pain? Like with sciatica is shooting down the leg. Is there a position, a stretch, a treatment approach that can get the symptoms out of the leg and more in the back? If you can centralize your pain, that's a great sign you may not need surgery, and you'll respond great to our treatment. So if you're suffering in sciatica or dealing with a herniated disc that's not fully resolving, we would love the opportunity to help out. You can visit our website today at pursuittherapy.com or give us a call today at 407-494-8835. Thank you.